let's talk about, not that we get them very often, but the difficult patients. You guys get to see them all. So talk to us about that and what your tips are.
Christina's the pro at pretending she's a difficult patient.
You can't lay me back very far. Okay, that's good enough. That's good enough right there, right there. And can you adjust this headrest and move that light? And actually, I can't have those glasses. I need the other glasses, and I can't have that prophy paste, and change your gloves, and I need to hold the suction. That person?
Yeah, exactly.
That person.
Or I love, I'm sure you've seen this so much at the front, the like, any morning, and you're like, okay, how about 8 o'clock? No, like 11. Like, that's not morning. Like, just what world? Like, I guess that's still considered AM, but like, I need early morning.
And so we will remind everybody of this point. So people are irrational
Human beings,
completely irrational, and we have to assume that when people are coming in and they're interacting with us, and just kind of tend to like push us over the edge.
Does not make any sense.
It's not intentional. Like, their goal was not, how do I come in and like ruin this person's day? Like, we have to assume that that's not their intent, and maybe there's the few odds and ends that just are the extremists of those groups of people, but that's not usually people's intent. There's typically some degree of a hidden need behind why they're acting the way that they're acting. So it might be like in the case of the patients that really come in and they need their chair reclined to a certain way, or they need to hold suction, that might really be just like
it might be an actual body thing, a comfort thing, and only you know your body. So we can't really judge people and say like, okay, like, well, how do you sleep at night? Like, come on, it's different. They're in a dental.
That's completely what we say.
Because
like,
I definitely say that.
How do you sleep at night?
I've so said that to a patient before. I'm sorry. This is before I became the owner of MVP. I promise. Where you're like,
we're all guilty of that stuff.
Yeah, we all have our moments, our learning moments, right? Where you're like, but how do you sleep at night? Like, I don't understand.
It's just your spit. You can swallow it.
We have those moments, but it's not about trying to justify it or understand it. That's the most important thing that we want everyone to get out of this, is that we are irrational human beings. There's no way to say like, this is why they do it. It just happens to be that this is what's right for them. And it's about approaching people as in, this is what's right for them. So that's what's right for their body, and let's help accommodate them the best that we can. And if we can align with them and build rapport with them, I bet you get an extra inch or two out of that chair, right? When you're able to understand them and they feel understood, you might get a little bit more out of it. But if you have somebody who's just being super cranky, or they come in, they come in 30 minutes early and they're like, are they ready for me yet? And you're like, your appointment doesn't start for 30 minutes. And they're expecting you to be, ready for them because they're there and their time is more important than you. It's like, how do you deal with that type of personality? And like you said it perfectly. I mean, we deal with, drills and needles. Like, people don't typically enjoy coming to the dentist. So a lot of times it can just be anxiety that is driving this irrational behavior. So a lot of people are anxious to be there. They were probably psyching themselves up the entire time. They might have been psyching themselves up for a week before this appointment to even get to this point. And now being here makes them act more irrational, a way that they probably don't act when they're not in the practice. It takes their personality and it takes it to the extreme and to a negative extreme. So we're seeing that side of their personality, and it's like, okay, what is the undercovering need here? What has happened? Is it because we create this anxiety for them, or did something else create this for them? Did they just have a horrible conversation with their boyfriend, or break up in our parking lot? They come in wiping away their tears and they're like, let's get this done. What's going on here? And it's really important to step back for a moment and realize that it's not us, right? Yeah. Have a way to be like, okay, this is not me. This is a them. This is me. They're just having a moment. And then analyze the situation, because we're really good at analyzing things. And just be able to look at it as, okay, where are they coming from? Why are they acting the way that they do?
Yeah.